السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومتريك Review of PROMETRIC Test Question. This is lecture number 1 in Maternity and Child Health Nursing and number 40 in Ghaith Review. Today we are going to discuss 5 questions from question number 217 up to question number 221. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 217. At which stage in the monthly cycle does ovulation typically occur? The options are number A, 7 days before the end of menstruation. Number B, 7 days after the last day of menstruation. Number C, 14 days after the last day of the menstrual cycle. Number D, 14 days before the onset of the next menstrual cycle. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number D, 14 days before the onset of the next menstrual cycle. ليه اخترنا الخيار رقم D نشوف rational. Ovulation is the release of a mature egg from the surface of the ovary. Usually occurs mid-cycle, around 2 weeks or so before menstruation starts. So the correct option is option number D, which is 14 days before the onset of the next menstrual cycle. Question number 218. A woman informed a nurse that she was never vaccinated against rubella. Which of the following is the best nursing advice? The options are number A, no need for her to be distressed. Rubella is not harmful to the fetus. Number B, the vaccine can be administered anytime during her pregnancy. Number C, she can get pregnancy anytime after receiving the vaccine. Number D, she should be vaccinated after delivery of the baby. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number D. She should be vaccinated after delivery of the baby. ليه اخترنا الخيار رقم D نشوف rational. Rubella is very dangerous for a pregnant woman and her developing baby. Because measles, mumps, rubella vaccine is an attenuated live virus vaccine, pregnant women who are not vaccinated should wait to get MMR vaccine until after they have given birth. So the correct option is option number D. She should be vaccinated after delivery of the baby. Question number 219. A 29-year-old woman had been diagnosed with a 3 cm ovarian cyst. Which of the following is the appropriate step in management? The options are number A, cyst aspiration. Number B, hormonal therapy. Number C, cyst removal by laparoscopy. Number D, examination after next menstruation. وقف الفيديو هنا واختار الخيار اللي بتشوفه الصحيح. The correct option is option number D, examination after next menstruation. ليه اخترنا الخيار رقم D نشوف rational. Ovarian cysts are fluid-filled sacs that can form in or on ovaries. The most common type of ovarian cyst, known as functional or ovulatory cyst, is completely normal. It develops every month with ovulation. They are not usually harmful, have no symptom, and typically go away after a woman's period or after pregnancy. Therefore, the appropriate step in management is to check after next menstruation may be disappear. So the correct option is option number D, examination after next menstruation. Question number 220. A diabetic mother delivered a full-term neonate by cesarean section. infant is admitted to the neonate intensive care unit for observation. This infant is at risk of which of the following complication? The options are number A, pneumothorax atelectasis, number B, hyperglycemia, number C, atelectasis, number D, hypoglycemia. وقف الفيديو هنا واختار الخيار بالشوف صحيح. The correct option is option number D, hypoglycemia. ليه اخترنا الخيار رقم D؟ نشوف rational. An infant of diabetic mother is more likely to have period of low blood sugar, hypoglycemia, shortly after birth and during first few days of life, because the baby has been used to getting more sugar than needed from the mother during the uterine life, and they have a higher insulin level than needed after birth, that resulting in lower the blood sugar. So the correct option is option number D, hypoglycemia. Question number 221. The midwife was assessing a 36-year-old gravida for para-2 mother. The patient was in labor for 10 hours and had an extraction. 2 saturated baths were fully soaked with blood, with hours being admitted in the postnatal ward. Which of the following is the appropriate nursing diagnosis? The options are number A, anxiety related to blood loss, number B, fatigue related to lack of oral intake, number C, activity intolerance due to discomfort, number D, fluid volume deficit due to uterine atony. وقف الفيديو هنا واختار الخيار بالشوف صحيح. The correct option is option number D. ليه اخترنا الخيار رقم D؟ نشوف rational. Nursing diagnosis is a clinical judgment about individual or family or community response to actual or potential health problem or life process, based on the assessment data that the woman is experiencing postpartum hemorrhage. There are many nursing diagnoses for postpartum hemorrhage, such as deficient fluid volume, ineffective tissue perfusion, risk for infection, and anxiety related to blood loss. But the priority for fluid volume deficit. So the correct option is option number D, fluid volume deficit due to uterine atony. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.